When a study finds an association between two things, that does not mean one has caused the other to happen. The title of this study suggests that prednisolone has a worse lipid profile than hydrocortisone, but if you look at the data, in fact you find the opposite is the case. Let's look at this data. It was done in 19 centres in 4 countries, and they basically looked at prednisolone between 3 and 6 milligrams daily and compared it with hydrocortisone 15 to 30 milligrams daily. And they found that there was a higher cholesterol and a higher LDL in the 47 patients on prednisolone compared to hydrocortisone. But cholesterol and LDL are not known to be put up by steroids. HbA1c is, however, but for this they found no difference. They found no difference in the BMI, they found no difference in the systolic or diastolic blood pressure. So things that are known to be put up by steroids were not increased, and they did say there was no differences in these things. However, at the bottom, the conclusion says that there still were significantly higher LDL levels, and they then say that this could predict a higher risk of disease for these patients. The dose that was used of prednisolone in this study should have been between 2 and 4 milligrams, but this is in less than 10% of the patients. Most patients were on between 5 and 6 milligrams daily, which is a much too high a dose of prednisolone. When you compare the groups of 47 on prednisolone, they in fact found that 4.3% in fact had type 1 diabetes. Now, of course, prednisolone can't possibly cause type 1 diabetes. It can cause type 2 diabetes, but the risk of this was lower in those on prednisolone compared to those on hydrocortisone. So if we look at the data in a bit more detail, there were 47 patients in that group, and you'll see that the BMI in fact was lower in the prednisolone group than the hydrocortisone group, and this was 44 patients in the prednisolone group. They had a systolic and diastolic blood pressure for all 47 patients, and again you can see that the blood pressure, both systolic and diastolic, was lower in the prednisolone group than in the control group. The HDL was not different, and the HbA1c and triglyceride also were not different. But this is incomplete data. There were only 31 patients that were studied for HDL and HbA1c, but nevertheless they found no difference. So although they used the wrong dose of prednisolone, which is too much, even then they found that the blood pressure and BMI were lower in those on prednisolone. So all of these found no difference, and if anything, the blood pressure and BMI, things known to be affected by steroids, were lower in the prednisolone group. But they chose to ignore this and instead analysed only in these 47 patients the total cholesterol, but note that there's only 36 patients where they had that data, and similarly the LDL, again, there are only 34 patients, and they, instead of quoting all the patients, they simply said that in these 36 patients, that's a subgroup, their conclusion is that there's a significantly higher LDL and total cholesterol in patients taking prednisolone for adrenal insufficiency. Now, if you look at the actual data, it's incorrect, because in the abstract they say that they found a higher cholesterol in 47 patients on prednisolone, but in fact they didn't do that. They only had cholesterol data on 36 patients, so the abstract misinterprets the data in the actual paper. In these 36 patients the cholesterol was higher, but cholesterol is not known to be put up by steroids. Their conclusion, however, is that prednisolone leads to an adverse lipid profile, and really strangely, they say it should be used with great caution as hormone replacement therapy. Now, this is a bit unusual and difficult to explain, but it might be because the study is funded by Shire, and they're concerned that prednisolone might be a direct competitor with their drug Plenidrin. And I think the correct conclusion should be that publication sponsorship need to be viewed with caution. Let's look at the correct interpretation. The correct conclusion is that there's no difference, and if anything, the blood pressure and BMI are lower in patients on prednisolone than hydrocortisone, and the correct conclusion should be that prednisolone is safer than hydrocortisone as replacement therapy in Addison's disease.